Good afternoon, friends. Good afternoon. Because
one last minute, sorry, sir.
Yeah,
Sorry,
please carry on.
Sorry, I just want all of you to know that even before I come, the introduction of the new ATP candidates will be done, and then we will go on to the debate hour by the time I finish. Okay?
So the next talk will be by Dr. Jeewan Titiyal, sir, who is the chief of RP Center, and he'll be talking on time-bound activities that I perform as an administrator and overview. Dr. Titiyal, sir.
I don't know what to talk about this. This is something totally different talk which I've never made in life. फिसलना नीचे यार. रुक जाएगा ना? But I think I can make some justice out of this, because this 8-10 minutes, let me throw some light to a young generation sitting here, leaders sitting here, because they may become an administrator. And yesterday I was talking about, curriculum. It is unfortunate that, we make, physicians, surgeons, and, doctors, but we don't make administrators. We don't have anything in a curriculum to teach them what's the art of, administration to manage things. And that challenge normally forced onto you when you become a faculty in some institution. And fortunately, its center, which was developed way back in 1967 with the vision of Professor L.P. Agarwal, where we had the various organization departments where everybody was looking after some specific areas. And that also gave an opportunity to lead that area, to build that area, and think for a future how it's going to develop. So these subspecialty clinics which he started in those days, we still follow them, and now they have become a super specialty areas. Not only for an institution, academic institution, for everywhere in the world also, we now look for a super specialization. In fact, that will become a ultra super specialization in the next few years. Retina will not become a super specialization. That's a subject now. In retina also, you'll have a various subsets which will become super specialization. There will be one person doing only macular treatment, maybe a medical, surgical. Similarly, in areas like cataract, refractive also. And that's the future. And this is what I'm looking after, the large gamut of people in RP Center, and which has almost 1,000 people working in the center. This is a part of All India Institute of Medical Sciences. And RP Center is 320-bedded hospital. And it has so many other gamuts. So we have now 51 faculty, around 150-60 resident doctors doing SR-ship, or a residency program, 96 optometry students, 15 PhD students, around 200 plus staff nurses, and more than 400-500 other staffs to help RP Center. So these are people who I have to look into, and which are the administrator responsibility, which is maybe a time bound, because everything in time bound nowadays, if you are an administrator, you can't say I'll do it tomorrow. It has to be done within a frame of time. The center-related activities, which I do every day, clinical work and the surgical work areas, the AIMS-related administrative works, which may depend on various meetings, committees, and most important and most difficult part is dealing with the government agencies, which is really time-bound sometimes, and addressing the public grievances. That is, I think, major challenge for any administrator. You do have a grievances in your own working area, but the public grievances are one which has to be dealt in an appropriate manner, and it has to be answered to your own administrative area. Not only that, you have to answer to the agencies which are governing those institutions, because we are a government-supported institute, so it has to be answered to not only the health ministry, it goes to the PMO also. So these are various responsibilities which we have: clinical, OPD round, teaching, OTs, and the more importantly, which I've realized since I became in charge of a budget for last 10-15 years, because that is one area in the institution which will keep the institution growing. Unless you have a budgeting properly, you can't grow, because you have to acquire various devices, equipments, improve the facilities, enhancement of pre-existing areas. You require a proper budgeting, and to win that budget from the administration is a real challenge and art, and how you face them, because everything requires a justification. Because whatever you do, if you don't have a proper justification, you'll never succeed in acquiring that or achieving that particular project of yours. Then you have various other important areas, recruitment of various staff, not only faculty, up to the sweepers and the multitask workers and lift operators. That you have to look into that area and make sure you have a right person coming in those areas and keep looking for their work also. Then other important area which as a RP center chief has is an important role is assisting the Ministry of Health in blindness programs, other surveys, which is a very important aspect. In fact, we have done justice in last 5 or 6 decades in this aspect, and we have done so many surveys, not only with the Ministry of Health, we are doing with the WHO as we are the collaborating center for WHO in the country. Then other important area which I have listed here is the parliamentary questions. We do a lot of RTIs. This is a part of a job, but parliamentary questions are one which are thrown to you in the morning and they want to answer by afternoon. And they are questions which are difficult to answer. And this is a difficult part and it's real challenging. And next day you get a query why you have not sent the answers. So this is the actual time-bound thing which is very difficult to answer. RTIs we do have to answer because we come under the government institution. So you're part of RTI answering, and sometimes there will be very very silly questions which will be difficult to answer. Although sometimes they may be very important RTIs which will change the concept of a person who has put a RTI, but concept from the administration also change everything also. So I would request people listening here, they should look into a government sector RTIs in a manner. Don't think they're going to pull you by RTI. Think what mistakes, what improper things we are doing, or what positive thing we are doing and how we can improve. That is a good area to look into these areas. So all these areas are time bound and which has to be managed in a proper time. For that, I think as a single person handling as a chief or a director, you require a proper staff to support you. So you have to plan them, delegate your duties to other people, prioritize troubleshooting, and support your team. That is the most important thing. Let's look into a OPD or other area which is handled in RP Center. So under me, I have a medical superintendent in RP Center. AIMS being such a large organization, there are only 2 medical superintendents, one for our entire AIMS, one for RP Center. In that way, it makes things simpler. So they are all answerable to me, and we can always sit down and discuss. For every area, I have made a faculty in charge. So they look into these areas and they keep taking rounds. OT, we have a separate OT in charge. Similarly, for other clinical works, we have a different in charge for these setups. The ultimate responsibility, whatever is done by people, goes to the highest person. If something goes wrong, it may not be answerable by those people, but ultimate answer is to be done by the person who is in charge. And that responsibility you have to take. That means the mistake done by the junior most person goes to the senior most person. So it is a huge responsibility, especially if you have you're working in a city like Delhi, which is a capital city. A lot of bureaucrats, politicians, they approach AIMS, and over that you have VIPs, and over there you have a super VIP, we call BBIPs, where there's no time. They might come in the middle of a night and you have to be there, and they might call you in a non-working day, you have to be there. So that's a challenge we always face. Apart from that, being a clinician and teacher, I have to take my responsibility for that area also. Take classes for all categories of students, right from the resident doctors to undergraduates, BSc students, and the PhD classes in these areas. And more importantly, I love taking rounds, which I do twice a week. And that's a clinical round of my unit where entire team of my resident doctors are there and faculty group is there. And there what we actually inculcate the teaching, the lessons, knowledge to younger generation to become that. Budgeting I talked about, because of good budgeting to AIMS, we could acquire equipments, instruments, infrastructure. Now, today, I think there are few institutions who can compete or compare themselves with the good private institutions. And private institutions are standalone ophthalmic institutions where we are the part of an entire university. And it's very difficult to sustain that pressure, offer newer things coming every time in next every 5 or 10 years. This is our patient load we see every day. Our OPDs are 2,000 plus every day. And we do around 150 surgery per day. So despite that huge manpower, our effectivity is not that much. If you look into 1,000 people in a center, we are not producing the outcome-wise, the manner which private sector would have done with that, they would have done at least tenfold than what we are doing in that manner in terms of a load-wise. But in terms of our teaching-wise, we are doing much better than any other institution because we produce the best brains out of RP Center for the country, for the world. Research is our priority. We are also working on that research. The time-bound thing, which I look into, presentation of people in time, completion of their research in time, getting your analysis done in appropriate manner. Most important thing which administrator has is the appraisal. That is looking onto checking what has been done in that particular area by that particular person or that particular committee or unit. The appraisal is a very important part for us succeeding to manage a proper unit. I say unit because everything is unit. If there's an appraisal, you'll do better. To make sure you have a monthly, 3-monthly, 6-monthly, 1-yearly appraisal. As far as our faculty is concerned, we do 1-yearly appraisal. For other staffs, it's a daily or a monthly appraisal to be done in these areas. Here, I would like to highlight a few important things like we are doing a blindness surveys. We are doing a trachoma survey, as I talked about yesterday. India is yet to be declared in a WHO list a trachoma-free country. But you all understand we hardly see trachoma nowadays. We would have been listed 30 years back trachoma-free. But now we are doing a survey because the survey requires to be done for a whole country. Now we are doing for at least 270 districts of our country. We are nearly completing by this month. Huge sample size, and we know that is less than what WHO recommends, less than 5%. We are around 3% of trichiasis, that is sequelae of trachoma. So no, we are not looking for active. Active trachoma, we are declared free in 2018-19. We are looking at sequelae. That means if sequelae are not there, that means trachoma was not there for last so many years. So hopefully this year, by end of mid of this year, by end of this year, we'll have a WHO reporting and labeling India trachoma free. Parliamentary question I talked about, grievances is another important part. We do have a teams, committees, not only for public related grievances, hospital related, and nowadays major challenge is student related grievances. A lot of mental, physical stress is there, and the harassment part is one of the most difficult part to tackle with. That we have to do every time. And I know that you have only 24 hours. You have to divide that 24 hours into your own areas also. I do work every day, average of 10 to 12 hours a day. And I'm the first person to come to hospital and last person to leave. So that is the responsibility as an administrator, as a moderator of an entire area. You have to show that you are the most punctual person so other people follow that. I remember the days of Dr. L.P. Agarwal. He used to stand in the OPD gate. We had only one gate those days to entry at 8 o'clock sharp. And anybody coming after 8 o'clock was taken away and fined for a day for 25 rupees. And 25 rupees those days, sir will remember, is a huge cost. And but 1st October, you have to wear a tie. Without tie, you can't enter from the October onwards. And the maintenance of your status depends on how well you are dressed. If you're not properly dressed, then the entire scenario goes difficult in terms of patient and don't understand this is a good area, clean area. And I remember now for last, since I think now 10 years, the government has the program, at least 8 years, Kaya Kalp, which looks into the facilities and the safety and the cleanness of our various hospital areas. And amongst the various institutions, AIMS always stood first. Amongst the AIMS, RP Center always been number one in a Kaya Kalp program. That's because we handle the RP Center very, very effectively in all areas. And thank you for kind listening and the entire team of mine.
Thank you so much for that wonderful presentation, sir. From the time you enter in the hospital, from the time you are leaving, you are playing multiple roles. You are a manager, you are a clinician, you are a business person. And other than the ophthalmology training, you were not trained in any of these. And you are dealing with crores of rupees every day, managing 300 people. How do you actually manage all this, sir, without any training? What would be the message you would like to give the leaders of tomorrow, sir?
The only message, I've been working on that to have some sort of involvement of an administrator in the hospital systems. So we have now for last 20 years, we have a course which is called MHA or Hospital Administrative Area. So hospital that is being done, master in hospital administration. Those people are supposed to handle the other areas of hospital management. But as a person who is doing medical education, there has to be something in terms of a maybe some sort of a little bit of MBA related type of teaching has to be there in a curriculum, which will make sure you learn. Other thing is every time the institutions should have a sort of a seminars and discussion with these people and give you the teaching and tips of how you handle. Like I was talking yesterday, residency program, we didn't have a structured residency program. We all learned by seeing other persons. We learned by mistakes and good things of other person. Same thing is happening for us also. We learned from seeing other seniors how they handle and trying to learn. In that process, we do mistakes also. It's not that we don't do mistakes. And with that mistake, we have learned many things also. And I can understand if you're doing some work, unless you have a mistake, that means you are not doing work properly. So
Can we have some comments from the expert panel, Guru Prasad sir?
Yes, sir. Yeah.
Yeah, I think there are two types of people. We all know type A and type B personalities. And it's impossible to be an administrator or a head of an institute if you're a type A personality. Because you end up doing everything yourself. You try to do everything yourself, and you end up not doing anything right. So I think it's better to be a type B and get things done by the type A people. That's what is the definition of a type B person.
Pradeep
So
Sarup
that is-
sir?
How effectively have you been able to delegate your work?
I think, Dr. Sarup, that is the most important part we have learned in RP Center, delegation to your, team of people. That's why we have 51 faculty members. All 51 faculty members have a responsibility. They've been given responsibility not only for, academics, for everything, right? From the administration of various areas, stores, management, which is the most important area for everybody is in charge for everything and they are responsible. And their responsibility has to be accountable. That is more important. And since I've taken over, we do have monthly review system for everything. We have started. We didn't have the you can say review of budgeting, review of your stores, review of accounts, review of patients coming to various clinics and OPDs, and we are trying to change every day the new things. I hope that whatever time I have, I can make some new change and we survive the onslaught of newer things coming in the practice.
Thank you so much, sir, for your.
Give us an example of a parliamentary question which
There will be one question. Suppose how many ventilators are there in the institute, various government institutions, and when they were installed, how effective they were, how many patients were treated, and how were they procured? This will be a question, and it will come to the director AIMS. He'll put it to his PS will put to every area and chiefs of center, head of departments, everything. And he'll come to RP center. Then I have to think, yeah, we don't have ventilators. What to answer? Then I write medical superintendent AIMS to answer. The question will come, you are a part of COVID management. The entire team was managing COVID, so you should answer this also. Right? You didn't have any ventilators. Then you say, okay, write this. Then there was a question in Parliament subsequently, why entire AIMS RP Center never had one ventilator. So there should be one area developed in RP Center for emergency care, and they should start ICU in RP Center. So that's a positive thing also, negative thing also. Once we start an ICU in RP Center, everybody will take a claim on that because that's an extra space for people. And today, AIMS is so congested, you can't have an extra space. So people are fighting for the space. This is one example. Other examples are there, like suppose one person commits suicide in AIMS. The question will come, please, tell us how many students come from which area, which is the background, what has been done when they join, what are proper counseling done or not, who is in charge for this, and how many in last 10 years done this, and please answer effectively in 1 or 2 hours. So it's so difficult to answer these questions. I'm not going the other question which I can't disclose here.